I want you to understand what symptoms mean and what they should tell you about your health and about your body. Learn how to read your symptoms. When you don't understand symptoms versus cause, symptoms versus problem, okay, then the headaches themselves become the problem. Say yes if you get that. So it all becomes, let's make the headache go away, all right? So, of course, the question is what can I do, what can I take to just make the symptom go away? Most people come in and they say, Doc, I've got this going on. What do you think, should I take this? And I'm like, I don't know. Is your objective that you want to live a longer, stronger, healthier life? You want to reduce your chance of having heart disease, heart attack, dying of a heart attack? You want to increase longevity? Is that what you're trying? The problem is very often drugs will work and they will quiet the symptom while you get sicker. So we need a better way. I want you guys to understand back pain because for most patients and healthcare practitioners, low back pain, sciatica, disc problems, disc herniations, it's a big mystery out there. We're going to talk about what causes back pain because I want you guys to understand the mechanisms involved because I truly believe that if patients know more about their bodies, they take better care of them. Yes, if you're with me on that, okay? And thirdly, what you can do to stop it, all right? I always address this topic from the three-legged stool perspective. Has anybody ever tried to sit on a two-legged stool? No, okay, so what does a three-legged stool imply to you? Imagery, right? Okay, so all three legs have to be in place for you to be what? Successfully sitting or successfully healing, as this conversation will be. So the three legs of the stool that we're going to talk about tonight are adjustments, and adjustments done in rhythm. For those of you who don't know what adjustments are, you will by the time you leave here tonight. Breaking bad habits. The bad habits that promote subluxation patterns and promote problems in your spine, all right? And thirdly, we're going to talk about the exercises that you need to do to strengthen the soft tissues around the subluxations, around the problems, so that you can not only heal, but get back to function. Because we're not pain doctors, we're function doctors, okay? We're not back pain doctors, we're not neck pain doctors or headache doctors, okay? We are function doctors. I want you to get back to life. I want you to get back to whether that means playing with your grandchildren, being able to vacuum your house, go horseback riding, or do CrossFit, or compete, or be your best. Reach your optimal health potential. Function, we want to see increased function, okay? And that means you're going to need to get stronger. Say yes if you're with me. There's basically two major types of inflammation. There's acute inflammation, which is the swelling that most of us understand. You sprain your ankle, there's soft tissue damage, there's basically a chemical reaction that happens in the body, and you swell, okay? That is innately appropriate. Now the second type is what most people don't understand, and that is inflammation on a cellular level. It's an insidious, low-grade, chronic inflammation, silent inflammation. Chronic low-grade inflammation looks like this. Read this list now. Heart disease, high cholesterol, high blood pressure, strokes, mood disorders, depression, anxiety, brain degeneration, Alzheimer's, senility, obesity, diabetes, cancer, there's the trail, right? Joint pain, swelling, arthritis, atopic disorders, allergies, asthma, eczema, and acne, poor recovery and healing, and immune responses. Sound like anybody you know? I won't make you raise your hand or stand up and stomp your feet if it sounds like you.
get started, everybody, before we begin, we just wanted to share a few stories with you. Throughout our experience here, we've come in contact and met so many great people who have some amazing stories. We want you to have a chance to hear some of those stories. So we're going to start with Sarah. Sarah's going to share one of her stories tonight.
Yes. Before I go into that, though, I'm just going to touch on a few housekeeping topics. One is that you may all know already, but we have a Mom's Tribe here, run by Heather and Dr. Camilla. They meet once a month. Our next one is on March 21st, and they'll be touching on how to care for your sick child. They start at 6:45. Also, our next Body Signals workshop will be on sleeping problems. So we'll be handing out information on that throughout this month, and then that will be on April 3rd. And let's see, all of these workshops will be recorded and put on our website as well as in our lending library. Following that, one of our patients, she's not able to be here tonight. She's a dance teacher, but her daughter suffered from some pretty serious constipation issues. So I would just like to read her testimonial for you guys. My daughter Cameo has just finished her first 4-month period of chiropractic work, and she's doing amazing. I cannot express to your practice how you have truly saved my daughter from upcoming years of severe pain. Since Cameo was born, she has had a horrible time with her bowel movements. Her traditional doctors have put her on so many medications and even had us try some painful outpatient procedures to get her bowels working again normally. Nothing worked. I had about given up. I just could not see her be in such pain at such a young age. Being 4 years old and bleeding every time you have to do something normal is not right. Cameo even knows it's not right what these doctors have put her through. A friend recommended Franson Family Chiropractic for myself, and while I was there, I had Cameo checked as well. To my surprise, she bonded extremely well with Dr. Justin, and immediately after her first adjustment, my daughter had no complications going to the bathroom and has not had problems since. I'm completely shocked at what I've seen here. From bleeding every time and having to take medications daily, it all stopped. Dr. Justin saved my little girl from daily pain and made her adjustments fun and easy. I now know that I'm in the right place, and my whole family is on a path for better living without pain. Who knew something could exist? Thank you, Dr. Justin, for all you've done for my little girl, and we look forward to continuing her wellness program with you. So Dr. Justin, I think, is going to take it from here.
Yeah, sure. I'll take that. And I believe, Joanne, you'd like to come up and share with us? Great. If you want to just hold this right there.
Okay.
Great.
I probably can talk loud enough. Hi, I'm Joanne Lonigan, and I first met Dr. Franson about 3 years ago at my health club in Danvers, and I thought I was doing pretty well. I had some issues with acid reflux. Got to do that. Okay. With acid reflux, and but I was taking, as I was told, my little best friend that I would take for the rest of my life, Nexium, and didn't really talk about it to Dr. Franson when I first started coming. He was working on other issues, and then I just got to the point where I actually ended up in the hospital, and because I had some food stuck, and so he started working on it, and that was and then it was getting better, and then he convinced me about the paleo diet, and that really finished it off. And today I used to feel like when I went home I was sweaty, I was bloated, I couldn't wait to get home and finish my day. And now I have energy, I feel great, and I don't have a little best friend, so thank you. Thank you.
All right, the next person I'd like to have come up is Adrian. Okay. She's a little nervous, so I'm going to walk her through it. All right, so come right on up here. Great.
Okay.
So, Adrian has been coming since last summer. Okay, when she first came in, she was coming in with some neck pain and some stomach issues. And so she's going to share some of that story with us tonight.
When I first came in, I was in here for a headache that I had for like 5 days. And Dr. Jesse, who was fabulous, he helped me out, and I finally got rid of that headache. Kept coming because I felt so good. Then I started to talk to him about my stomach problem. And I told him that I was diagnosed with IBS about 10 years ago, I would say. And it's miserable. You never can go anywhere. You know, it's just, you know. I have called in many a time, couldn't make it. But he started working differently on what he had to do and told me about the diet. And I laid off the wheat and the grains, which I thought was healthy at the time, but it was really bothering me. And I've been on it now, and I really feel really good. I love it.
Awesome.
Yes, it's awesome, and you're awesome too.
Thank you so much. Great. And last but not least, I would like to introduce Mr. Paul Caruccio. Here you go, sir. There you go.
Well, hello. My digestive journey started when I was 16 years old. I was diagnosed with IBS, inflammatory bowel syndrome, irritable bowel syndrome. When I was 18, I was finally diagnosed with an ulcerative colitis condition, which is basically my colon wasn't completely diseased and it got progressively worse. Upon that diagnosis, I was put on some pretty heavy sulfa drugs for about 8 years, which after 8 years, those were proving ineffective, and so they decided to up me to steroid medication, which I was put on that for 5 years. And unfortunately, I was put on the highest doses of steroids possible, and that was proving ineffective after 5 years. Plus having complications from that, brittle bones, and the fear. I was a young dad at the time, and the fear of sterility was coming in and all this stuff, and I was like, wow, that's not good. So after 14 years of my illness, and probably going to the bathroom, bowel movements 20 times a day with bleeding and fatigue and anemia, everything else going on, we decided to go the surgery route. And so I actually had a total colonectomy, which was actually a very successful surgery, but supposed to kind of cure the problem. So in other words, you take the colon out, you cure the disease. Unfortunately, that didn't work either. And so after within a year after the surgery, I was having other complications which affected the internal pouch that they created. And so again, suffering with that for another 5-6 years, and more medications, more antibiotics, and nothing was proving anything helpful. So about 2.5 years ago, was it now? I met Dr. Steven and their family, and he encouraged me to come in and started having adjustments and just being educated about my health, my diet. Started on probiotics, fish oil, having regular adjustments, and it was incredible because I was without symptoms from that point on. Is really remarkable. And so I don't have a normal system, but as normal as I can be, and with the adjustments and the help of the practice here, it's been incredible. I joke with Dr. Steven because he also put me on a pretty good exercise regimen. You know, we got to move well, eat well, and think well. And so I always joke that he invited me to his house in his barn, and I always say I hate going to his house because of what I know I'm going to face when I go there. But I love leaving his house because it always feels great knowing that I've succeeded in that. But I want to introduce my friend and my doctor. He's been an incredible influence in my life, and he and his family. Or do you have? Am I drug free now? Yeah, I'm actually I take probiotics and that's it. So that's about it. So I'm completely off of any medication, and all my the medical numbers have been come back, and I'm actually doing great. I feel great. I feel better now than I did when I was 25, really. So, and I'm old now. Well, ask my kids. But anyways, let me introduce Dr. Steven, a great friend. His family have become very close. Dr. Camilla and my wife have become great friends. Our kids grew up together. He's an incredible coach. As you know him as an incredible educator. But he's also an incredible brother in Christ. And from my background, I'm in full-time ministry. And one of the things I appreciate most about Dr. Steven is his commitment to really give of his God-given talent to help people and to restore really people to their original God-given design. And it's a shared passion that we both have, and something that I love about him, and love about how he continues to prove that out in his practice here. So welcome, Dr. Steven Franson.
All right. How do I not screw that up? Welcome, everybody. How we doing?
Great.
Come on, how we doing?
Great.
We got another winter storm? Yes. I love storms. You know, I was in Puerto Rico last week. Yes. Surfing, picking up a tan. And man, I missed the slush, and I missed the scraping of the windshields, and it's amazing. You get down in that 89-degree sunny temperature, and you miss it. So I'm glad that we're blessed with another storm this week. So thanks, everybody. Can I get another round of applause for everybody that shared their stories here tonight? All right, so this is the Body Signal series. So every month we're going to focus on a specific symptom or condition or disease process, someplace where the body's health has gone sideways. And we're going to get really specific and bring you guys information. We're going to try to make it very pragmatic, very actionable, so that you guys will know what to do to get healthier. I want you to know that the format of these workshops is fast and furious, all right? So my goal is to do 30 minutes of delivery of content that's relevant to this information, which means we're going to go fast, so listen fast, right? And then I'm going to open up the floor for questions so we can get right to what it is you guys want to know, and if you have specific questions about this topic, we can get to those things. So you're going to allow me to just go first and, hold your hats and take notes, and then at the end you'll have an opportunity to ask questions. Fair enough? Okay, so we're going to try to make this happen in about, let's say 30 minutes. Go. All right, so tonight, eliminate stomach issues. Where do we start? These are the things that we're going to be really focused on tonight, because I think these are really the big ones that we see. We've been blessed with one of the biggest wellness clinics in the world, right? So we see lots and lots and lots of people. So I get to see a really good sort of transection of the community and say, all right, so what are people struggling with nowadays? And these are the big three that we see quite a bit, is reflux, or acid reflux, or heartburn, or as my favorite Italians that come up from me, agina. Everybody's saying, I thought I was having a heart attack, doc. I get that one pretty much every Monday, and it's usually somebody struggling with some type of reflux. We're going to talk about IBS, irritable bowel syndrome, and some of the other disorders that are related, everything from Crohn's disease to celiac to diverticulosis and litis. So just hang in there. We're going to kind of cover some of those things, and all related around irritable bowel, and then chronic constipation. So always start here, and that is to help you recognize the power of this graphic and why we use this iceberg graphic. When we say body signals, the title of this body signals, essentially a body signal is just that. It's your body trying to communicate to you. Say yes if you guys get that, all right? So symptoms are body signals, all right? And one thing I want to make sure that we always understand and we embrace is the fact that symptoms themselves are not the problems. Symptoms are a communication from the body that there is a problem. Say yes if you get that, all right? So digestive issues are simply symptoms of a problem. It's usually symptoms of a bigger problem, right? So I love this graphic because, you know, what shows up above the surface when you look and you study an iceberg is around 75 to 15 to 20% of the iceberg is actually above the surface, where the rest of the iceberg is actually below the surface, okay? So we think of this as the symptomatology, okay? And the bigger problem actually lies below the surface, right? So watch this. What would happen if we came along and we successfully removed the top of that iceberg, chipped it off, and we left and we came back a week later? What would we see? Okay, so you'd see the tip of the iceberg again, right? And what would happen? Would this be bigger or smaller underneath it? Bigger, right? Okay, so the problem just gets bigger and bigger if we're just addressing what goes above the surface. So I think it's just a beautiful analogy for what we're trying to accomplish. So I want to teach you guys how to speak body, okay? Some people speak Spanish, some people speak French. I speak body. So in other words, I listen to bodies, and the body will talk to me, and it'll tell me what's going on with it if you really learn how to listen to it, all right? And I want to teach you guys how to listen to your body and understand what's going on. And what I want you to understand is here's a wellness continuum, all right? So let's say this is 0, this is neutral. All the way down this end is perfectly healthy, right? 100% function. And down this end, all the way to the end is dead, all right? Say yes if you guys get it. See that continuum? What I will tell you is every single one of you will land somewhere on that continuum, right? Mentally place yourself on that continuum. Every one of you fits on there, okay? Everything that we teach and everything that we do in our clinic, the purpose of what we do is to take anyone, regardless of where they land on this continuum, and move them that way. Say yes if you get that. Okay? So what you want to understand about symptomatology, about symptoms, is that when symptoms go up, your body's talking to you that something's going sideways. Okay? So when symptoms go up, what it means is that your inflammation's gone up. Your swelling's gone up. Okay, that's how I want you to read that. When your symptoms get worse or they're more pronounced, it means that your inflammation's gone up. Okay, and conversely, when your symptoms go down, it means your inflammation's gone down. Say yes if you get it. Okay, all right, do you see that? So when your symptoms get worse, I want you to say to yourself, what did I do that created more inflammation in my body? Okay? And when your symptoms get better, I want you to look at your behaviors. What are you doing that's making the symptoms go down? In other words, what's making the inflammation go down? Can we all talk body now? Okay, all right? So when the doctors ask you, when you come in and you say, hey, I get this going on or that going on, this is worse, we're going to ask you, what did you do? And don't say, nothing. You know, that's an answer that we don't want, or I don't know what I did, right? You got to think about it and you got to learn about the behaviors. So that's what we're going to teach you tonight. So God is good. And I was trying to figure out how I was going to respectfully address the pharmaceutical perspective on digestive issues. And then, you know, Larry the Cable Guy's ad came on TV. And I have a reputation for throwing my shoes at the television when drug ads come on. And I've ruined many good, high-quality TVs with a shoe that I just cannot stand these ads. This is probably the Mac Daddy of them all, right? Has everybody seen this commercial? You know, so here's Larry the Cable Guy, who is, I have to say, if I was going to pick a representative of my company as a picture of health and giving health advice, it's Larry, right? So, okay, so we got Larry the Cable Guy there, and he's standing in front of, yes, it says colossal corn dogs is the setting that they chose to say. And this is about the Prilosec, their ad about prevention. Okay, so the fact that you can now take a 1-a-day OTC over the counter and it prevents you from ever getting heartburn. So you can go, you know, so it doesn't interrupt you with living your life, you know, like this happy newlywed couple here with their corn dogs in front of the car. So can we all just agree that we need to move forward and start thinking a little bit differently? Because, you know, this, of course, is followed up with the list of side effects: headache, abdominal pain, irregular heartbeat, persistent muscle spasms, seizures, diarrhea, abdominal stomach pain, cramping, fever, blood, mucus in your stools, rash, itching, swelling, severe dizziness, trouble breathing. Sign me up, okay? We need a better way, yes? Say yes if you agree with that, okay? So thanks, Larry. All right, so let's lay some ground rules here. Whenever we're meeting in this clinic, we have ground rules, all right? And these are some of the things that we consider self-evident, okay? So number one, you are designed to be healthy. Say yes if you believe that. You're just designed to be healthy, okay? So we've had 3,700 generations of human beings have preceded you who were successful human beings, and they've passed their lineage on to you. You were designed to be healthy. You have been given, 99.6% of us have a perfect genome that if it's put in the right environment over time and you make the right choices consistently over time, your default is to express health. Get it? You're designed to be healthy. Number 2, you are intelligent. Say yes. Yes. There is an intelligence that runs every cell, tissue, organ, and organ system in your body. It's the same cell that took you, the same intelligence that took you from 2 cells, a sperm and an egg, to you in 270 days. Look at you. How awesome are you? Okay? Every single cell in your body has that very same intelligence in it. That's what's running your body. It's what keeps you healthy, and it's what heals your body. So you are intelligent. Number 3, your nervous system is the master system in your body. Your nervous system runs all systems in your body, so we call it the master system. And number 4, your spine is your lifeline. We're going to teach you tonight why that suit of armor that protects that spinal cord is actually your lifeline. And number 5, everybody say this with me, if you keep doing what you've been doing, you will keep getting what you've been getting. Amen? Amen. We need a better way. All right, so first we're going to go to Neurology 101. I want you guys to understand your nervous system. So if we look at this sort of academic image here, what you're going to see is here's a side view of the body, right? So here's the brain, here's the brainstem, spinal cord sitting inside of the spinal column, and then what you'll see here is the peripheral nervous system, the peripheral nerves that go out to all of your organ systems. Do you guys understand how that functions, all right? So we have this innate intelligence, the same intelligence that took you from 2 cells to you, that's breaking down your lunch that you ate today. All the essential fats are going to where they're supposed to go, all the essential amino acids are going where they're needed, right? You took 10,000 breaths today, you pumped 2,000 gallons of blood, you didn't have to think of 1 breath or 1 drop. How awesome are you? All right? That's the intelligence that runs your body, that keeps you healthy, and what heals your body. That intelligence courses across this nervous system. That's the conduit. That's the electrical system. So your body talks to the brain, and the brain talks back to the body, and it all happens across these nerves. An oversimplification, but it works, is to look at this like it's a fuse box. It's a power panel. All right? And just like in your house, you've got fuses that go to specific organs and organ systems, right? That's going to really apply and make sense for you tonight, because when we're checking a spine and looking at a spine, we know that the nerves go to certain areas and certain tissues and certain organs and organ systems. When those systems are going haywire, we trace it back to the source. When you come home one night and your fridge doesn't work and your lamp doesn't work and your TV doesn't work, do you start changing bulbs and banging the side of the TV, or do you go down the basement and look at the power panel and be like, which switch is off? Yes? Am I losing anybody? Okay, neurology. You guys are all neurologists at this point, all right? That's how it works, all right? So we're going to dive a little deeper tonight. We're going to go to Neurology 102 because we're going to talk about the autonomic nervous system. So the autonomic nervous system is one of the coolest systems in your body, and it runs your viscera, okay, all your organs, among other things, all right? There's 2 parts to your autonomic nervous system. There's a sympathetic and there's a parasympathetic, okay? The sympathetic nervous system is for fight and flight, okay? Sympathetic. You are either in sympathetic or you're in parasympathetic. Parasympathetic is for rest, repair, digestion, and reproduction. Okay? So this is the part of the nervous system that gets rest, repair, digestion, and reproduction. Okay? So sympathetic and parasympathetic. Think about it as if you were in your car and you look down and you get to that little transfer case and you go R or D, right? What does R mean? Not real fast, it means reverse, right? And D is drive. Can you go in reverse and drive simultaneously? No. Okay, so you are either in reverse or you're in drive, right? That's how your nervous system works, okay? You're either parasympathetically stimulated or you're sympathetically stimulated, okay? You are either in a fight or flight stage, okay, or state, or you're in a parasympathetic rest and repair. If you are down at the drinking hole, leaning down, getting some water, and a tiger jumps out of the woods, boom! You go into fight or flight, okay? So your body has this very appropriate adaptive physiological response to the fact that your life is now being threatened by a tiger, okay? That's fight or flee, fight or flight, okay? I suggest flight, okay, in that situation, all right? Now you run away, right, and you hide in the bushes or you get back to the cave and you're panting and you realize you're safe. Okay, and your body goes into a parasympathetic rest, repair, digestion, and reproduction mode. Say yes if you guys get that. Okay, heavy duty stuff, right? So that is the autonomic nervous system, and it has a huge impact on the way your viscera and your tissues work, okay? In other words, your overall health, right? You have to understand fight or flight. It's basically the gas of the brakes, okay? So we want to be in this relaxed state for our digestion to work properly, right? If there's a tiger jumping out of the woods at you, that's going to save your life to be in fight or flight, right? But if you walk around all day, every day in fight or flight, it's going to have an adverse impact on your viscera, the way your organ systems work. Does that make sense? Is that a big stretch? Okay. So the big idea. So why is the spine thing so important? Like, I mean, if you know anything about us chiropractors, you know, we're into spines, right? So why is the spine so important? Well, because frankly, your spine is your lifeline. Okay, this is your suit of armor. This is the suit of armor that protects that whole master system, that nervous system, right? So do you know what this is right here? Who can tell me what that is? Come on, more specific. It's the occiput, okay? So the occiput, this is the section of the skull right here, okay? So what's inside of the skull, right? The brain, right? Is the brain most important organ in the body? Yes, it is, right? Some people say the heart, but they're not doing a lot of brain transplants nowadays, are they? Although I know some candidates, you know, so the brain is fully encased in bone. It's protected, right, by bone, right? Now, if you look at the bottom of the skull, there's a hole there. There's a big hole, right, where your brain stem sticks through. That's, in Latin, that's called foramen magnum, which is Latin for big hole, okay? So that's where the spinal cord comes through as the brain stem. And then if you look at this spinal column, it's essentially an elaborate stack of joints, okay? And the joints are vertebrae, and there's 2 vertebrae that are separated by a disc, and there's 24 of them, right? If you stack them up on top of each other and you look bird's eye view down them, it's like a tube of bone. Everybody get it? Inside of that tube is the spinal cord. So the brain goes through the hole and becomes the brain stem, and that becomes the spinal cord. So if you saw open the skull and grab the brain and pull it out, you can pull it out like roots of a tree. Okay, it's all one big piece. Pretty cool, huh? At each one of these spinal joints, there's a nerve hole called a foramen, okay, an intervertebral foramen or IVF on each side. One goes right, one goes left. And this is where the nerve roots branch off, and that becomes your nervous system. You guys get it? All right. So this very sophisticated stack of joints allows proper movement and protection. You see, it would probably work really well, better even as a protective unit if it was just one solid tube of bone, yes? But you'd be rigid and you wouldn't be able to move around. So the way God designed you is it's a whole series of joints. So there's discs in between there so you have mobility and you can move around. So this is your suit of armor. But just like a knight with a suit of armor, where is the knight susceptible to injury? Where can they get a sword through? At the joints, right? So same thing with your body, okay? But the way these joints are formed is you'll see that there's a vertebrae, a disc, and a vertebrae. That creates a nerve hole. The disc actually acts as a spacer that creates room for the nerve roots to exit the spine. One goes right, one goes left. There's 24 pairs of those, and they branch out just like the roots of the tree. You guys get it? And when you look at a spine straight away or from behind, it should be straight up and down. Straight is strong. Okay, and the way we teach kids is it's just like a straw. If you push top and bottom on a straight straw, it's rigid and holds, right? If you put a bend in the straw and you push, what happens? It fails. So straight away, we want straight as strong. Yet, when you look at the spine from the side, there's this really awesome series of curves. These curves create a flexion and forgiveness, and that's the spring for the body. So people think that the disc is a spring, but it's not. The disc is not a shock absorber. The curves are the springs. So the curves become critical, because the curves are the shock absorber that protect the discs. If you want to have healthy nerves, you have to have a nice healthy disc. Nice big fat parallel disc space to allow room to let that nerve come out and feed your organs, including your digestive tract. Everybody get it? See, we're ripping right through now that we've gone through spinal anatomy, all right? So that spine will last you a lifetime as long as you keep those curves healthy and you keep those joints functioning properly. But what happens is we live our lives, right? And through traumas and bad habits, life, what happens is we end up jarring a vertebrae or a joint out of a healthy position. When that happens, it causes soft tissue damage and swelling. And the swelling puts pressure on the nerves. And remember what the nerves do. They're the conduit for the information that keeps you healthy and healing. Does this make sense? When a joint gets knocked out of a healthy position, either through trauma, car accidents, sports injuries, motor accidents, these things can obviously cause subluxation. But what we find much more commonly is that subluxation results from the cumulative effects of our bad habits. Things like poor posture. Everybody sit up. Slouching. positions in the workplace, poor positions in sleeping positions, okay? So these postural habituated bad habits, they create deformity and torsion on these soft tissues, and we end up with swelling and nerve irritation. So what you see is in this problem, subluxation. Everybody say that with me. Subluxation. Subluxation results. So subluxation, joint misaligns, creates soft tissue damage. Okay, we end up with inflammation and nerve irritation. So here's the bird's eye view. There's the spinal cord. There's the nerve root. There's the nerve root. It creates inflammation, nerve irritation, muscle spasms. Is your body smart or stupid? Smart or stupid? Smart. Very smart. Okay, so when there's joint instability, okay, and it senses that nerve irritation and you're cutting off the flow of life and information in the body, your very smart body spasms muscles around the joints to lock it down like a splint so you don't tear up the tissues anymore. Does that make sense? Okay, so is it smart or stupid to take drugs to relax that protective mechanism? Stupid. Right, and then you can throw some painkillers on top of that. Is that double stupid or triple stupid? Okay, so now you don't even have the warnings that you're doing it. So muscle spasms, because your smart body's protecting that from happening, and you get joint fixation, okay, and then you release stress hormones. So watch this. You release stress hormones in your body, which drives your body away from that parasympathetic rest, repair, reproduction, digestion, and drives you into what? Sympathetic fight or flight. Okay, so stress response. This is what happens to you in adaptive physiology. Watch this. And it's really helpful if the tiger jumps out of the woods at you, but deadly if you walk around like this all day. Because you got a boss that's a tiger waiting to jump on you, or a spouse, or a friend who's being a pain in the buttocks. Okay? Or just a modern life that's getting you chased down, all right? So adaptive physiology. Blood pressure goes what? Up, right? Heart rate goes up. Muscle tone. Remember, we're getting attacked by a tiger, right? Cholesterol goes up. Why? Your body's going to dump cholesterol into your bloodstream for stress hormone production to sustain this fight or flight and wound repair. Clotting factors go up, right? Just in case the tiger gets you, you're going to clot. Okay? Does this sound like a heart attack and a stroke waiting to happen? Okay? Fear and anxiety, they feed into that whole cycle. Okay? So now stress hormones are being produced. Why? Because we've got soft tissue damage and nerve irritation. Your body produces stress hormones like cortisol, catecholamines, epinephrine, and norepinephrine. Okay? So we see insulin sensitivity downregulated. Well, what does insulin do? Takes sugar out of your bloodstream, right? So we got insulin sensitivity is downregulated, so your blood sugar level goes what? Up, so you have more energy. Okay, so your insulin sensitivity goes down. So now you become less sensitive to insulin, less responsive. So what are you going to get? Elevated blood sugar chronically. What does that lead to? Diabetes. Type 2 diabetes, yeah? Blood sugar goes up. Immune response goes downregulated. Why? You're going to get attacked by a tiger. You don't need to be fighting bacteria right now. It's a very expensive system, your immune system. You need to be running away from a tiger. So it'll downregulate your cell-mediated immune response. So you actually get immunocompromised. If that tiger gets you, you're going to need to be repairing later and you'll upregulate your immune system. But when you're running away from that tiger, it downregulates that immune system because you're a battery and it's got to put the energy where you need it. Say yes if you get it. Yes. You're stressed out, your immune system drops. So when we tell you to come in here and get adjusted, when you're fighting something, we're not just being cutesy. We're telling you we're reducing stress hormones so your immune system comes roaring back for you. Sex drive downregulated. When you're being chased by a tiger, the last thing you should be thinking about is, sex, all right? Decreased serotonin. What's that going to do to your sleep cycles? Okay, so you're not going to be sleepy, right? So you're going to screw up your sleep cycles, okay? And then look at this. Digestion slows and stops. When you are running from a tiger, should you be digesting your lunch? No, short of defecation, there should be very little digestion going on, right? So everything, and think about it in the moment. Have you ever been really acutely stressed out? What happens to your stomach and your bowels and you get a little bit of that, right? But if you do that day in and day out, day in and day out, day in and day out, what happens to your digestive system? Slow it down or slow it down, right? Chronic constipation. Do you guys see this? I wanted to painfully drag you through that because I want you to see the implications of this. I want you to see what happens. Subluxation creates nerve irritation, which produces stress hormone production. And this is what your body does to adapt to it. And you get stuck like that. So we end up with problems like this. So let's talk about the big three. Chronic constipation. I like to say that an engine is only as good as its exhaust system. Okay? So we understand that this GI tract is a very highly sophisticated series of muscles, basically. All right? So it's this big involuntary muscular system. And what happens is, just like these muscles, we end up with tonal issues. Okay, so do you understand that the nerves control movement of the food along that track? That's one thing we have is motility, right? So as we swallow, that's a voluntary muscle, right? So, but there's lots of involuntary reflexive type things going on in there too, right? You guys have all been there, right? So we're swallowing, we've got this one-way track where it just keeps the food moving along, the bolus of food moving down the GI tract, right? So we've got very specialized tissues from the mouth to the esophagus to the stomach to the small intestine, the large intestine, rectum, right? So all of it's highly specialized. And this tissue is all controlled by what system? Very good. Parasympathetic, I was just looking for nervous system, but you guys are good. So sympathetic and parasympathetic have influence, but it's nervous system, right? The master system controls all the tissues. So what's happening? Think about muscles. Tone, right? Just moving the food along. How about mastication, chewing, all right? How about grinding, breaking down, churning foods in the stomach? Okay, so there's muscles working there, right? Then we also have pH, acidity, because what are we producing? Different digestive enzymes. What controls that? Nervous system. Right? Do you follow me? The pancreas, the liver, all that drawing water out, nutrients out. What controls that? The health of the lining of the GI tract. What controls that? Mucus production, pH, nervous system. Do you guys see this? This is beautiful. There's actually 3 nervous systems in your body, and one of them's in your, 2 of them are in your stomach. They say 2 in your digestive system. All right, so your nervous system and your digestive tract are so tightly connected. All right, intrinsic. So when we look at this situation, what happens is as this food moves along in this process, we end up with these tonal issues. So what we see with our patients is chronic subluxation creates chronic stress hormones, which slows the GI tract down and interrupts that normal flow through the system, and they end up with chronic constipation issues for multiple reasons. What we see clinically is typically one of these 3 regions in the spine. This is where you'll typically see subluxation. C1 to C2, C1, C2, C3, so upper cervical. It controls this one nerve called the vagus nerve. And the vagus nerve is one of the cranial nerves that actually influences the function of the GI tract. So sometimes it's an upper cervical problem. Very often with children, you'll see it as an upper cervical problem, okay? So when they deliver a kid, when they go to deliver the shoulder, they rotate the head a lot, and that can very often rotate and subluxate the atlas. Okay, the vagus nerve drapes right across the front of the transverse process of atlas. So when you have a subluxated atlas, it irritates the vagus nerve and changes the tone of the GI tract. Say yes if you're following me. Okay, so then we go down this and we see L1, L2. It's a common area to have issues with the mid to lower GI tract. And then L5, S1, S2, S3, bowel. Okay, so chronic constipation cases, this is what we usually see. And I consider this a real neurological issue. So the next one, IBS, irritable bowel syndrome, Crohn's disease, celiac. Okay, so what we're looking at is an inflamed GI tract all the way through. What I want you to understand is like if you look at the GI tract, this is essentially like a really sophisticated hose that goes all the way through your body, and it's got 2 openings. Everybody with me without me getting more gross than that? Okay, so food is not actually inside of you until it's broken down and it's absorbed and assimilated in your body. So everybody finish this sentence for me. You are what you eat. No, it's wrong. It's you are what you absorb. Okay? So it's not what you eat. It's not inside of you until you break it down and you absorb it into your GI, through your GI tract wall into your bloodstream. Get that? Okay? So something can go in you and go all the way through and out. It's not really inside of you. All right? So what determines what comes in and out of you is the walls of the GI tract, or the lumen, which is the inside of the GI tract. So picture it like a tube, a hose, okay? There's an inside wall. Everybody say yes if you visualize that, if you get that, okay? So there's the health of that inside wall that's really involved here with the IBS situation, okay? So this is kind of what it looks like. If you look at the GI tract right here, and then you zoom in, okay, it looks like this. So it's not just a tube like a hose, but there's all sorts of what's called invaginations or diverticuli that you'll see. And what this is it gives you a bit of a curvy pattern through. It's not just like straight like a hose. And the purpose for that is there's an increased surface area, so that there's more room for the body to interact with the foods and to pull out nutrients and exchange water, etc. Make sense? Okay, so this is a highly sensitive tissue, and as we zoom in, what we see here is that there's even these little fingerlings that go right out into the lumen of these cilia that just, their job is again to increase surface area and reach right out into that food and exchange nutrients and water, etc. Pretty awesome, isn't it? So this highly sensitive tissue is ultimately what determines who you are and how healthy you are, because it determines what foods and what nutrients you actually absorb into your body. It's incredibly important, right? And of course, it's the nervous system that maintains the health of that. So what we see with our patients with a subluxation pattern, again, very often is upper cervical subluxation, again, with the vagus nerve affecting the tone of that bowel, okay? Especially in like a diverticulosis situation, it's a tonal issue. And then T7 through T11 in the mid-thoracic spine. This nerve supply, again, is mid-gut. And what you'll notice down here is that I've indicated there's some chemical things here that are playing into this as well. This subluxation pattern here affects the tone, motility, the health of that tissue and the lining of the gut, the tolerance and the health of that gut. And then I'm going to talk to you about what some people put inside of their body that actually creates more of an irritation of that gut lining as well. I'm not going to do an exhaustive discussion of this, but I want you guys to have some what I call walk around knowledge around what you should and shouldn't be eating, okay? So when it comes to this specifically, I want to talk to you about what's going on with grains, okay? So huge shocker here, grains are not good for you and you shouldn't be eating grains. Whole grains are worse. Blasphemy, okay? So, you know, I'm also the guy that tells you not to give, you know, your kids milk, you know, so I'm the outcast. But you know what, if you look at the, the base of the pyramid today, which of course changes every year, you know, is grains. We're supposed to have 17 servings of whole grains every day. Well, if you want to look like a pyramid, then you should follow the pyramid recommendations, okay? So look around, look at America following, okay, we're through the food pyramid. We got to make sure that, you know, we've got all our grains and our dairy group and, you know, we've got that sugar group at the top. I mean, it's who's writing this stuff, right? But it's out of Harvard. All right. So now when we look at the grains, so what the long and short of this is that grains are seeds, okay? Think about what your ancestors would have eaten. Let's go back 3,700 generations. Let's go back 40,000 years, okay? 60,000 years, okay? What did the original human diet style consist of? Were they eating grains? Were they grinding little seeds? No. They would eat the rabbit that ate the grains and the grasses, and they'd get the nutrients from the rabbit. What they ate was meat and greens. That's what they ate, okay? Greens, not grains, greens. So they would eat the animals that ate the grains and the grasses, okay? They would eat the fruit of the trees, sometimes eat the leaves of the trees, but they wouldn't eat the seeds. Think about what we've done. We've gone from the fruits and the vegetables of the tree, and you take a step back and you start eating the tree itself, the leaves, and then you take another step back and now you start eating the seeds that make the tree. Okay? So why is this a big deal? Because think about what a seed does. What is a seed's job? A seed falls on the ground and does what? Dies. Okay? Basically, goes into the soil, breaks apart, breaks down, okay, into a very hostile environment, right? And it grows new life and grows into a tree that's supposed to create more fruit, right? So that seed itself is covered with what's called anti-nutrients. Okay? Everybody heard of gluten, gliadin, phytic acid. These are anti-nutrients, okay? There are elements, toxicant elements that exist in a seed, in a grain, that protect it in the soil so that, you know, that doesn't get fungus on it or something else isn't eating it, all right? So it's to kill off everything around it so that it can grow up. Does this make sense to you? Well, those toxicant, those irritant anti-nutrients irritate that gut lining, that very sensitive gut lining wall. Okay, so what we end up with is an irritation called leaky gut syndrome. All right, so you've got things like phytates, anti-nutrients, lectins, glutens, wheat, rye, and barley as sources of that, and you end up with leaky gut syndrome. So what does that look like? If we zoom in even more to this gut wall and we look at what the wall looks like, is it typically looks like this. There's cell after cell after cell after cell, and the cells, just picture them like bricks. They're slid really closely next to each other. There's a little bit of mortar in between them, okay, and they have what's called tight junctions. So this is outside the stomach, this is inside the stomach, and remember, it's not inside of your body until what? It's absorbed through the gut wall, okay, so it goes through the gut wall into the blood. Well, these tight junctions keep the foods from passing through here that aren't supposed to pass through and get into your bloodstream and get into your body. They protect you. So when you have these anti-nutrients in your GI tract, in your diet style, when you eat grains, it irritates these tight junctions. And imagine a brick wall that starts getting loose, okay, and that mortar starts breaking loose. And now what happens is these proteins that aren't supposed to be getting into your bloodstream can actually get into your body. And those proteins irritate your immune system and activate the immune response. So now your body recognizes these non-self proteins getting into your bloodstream from your diet style, and it thinks it's under attack like a bacteria, for example, and it mounts an immune response. So now you see swelling and inflammation and mucus, etc. Say yes if you guys are with me. Now I'm giving you a cartoon, shallow understanding of what's going on here, but it's important that you understand that it's the gut lining that gets irritated. So now we have subluxation, which creates nerve interference and weakness in this GI tract. Then we start putting foods in there that aren't supposed to be there, and we create irritation and the body can't heal. Does this make sense? Okay, and you end up with this leaky gut syndrome, all right? So, you know, I didn't want to do too much of this, but I'm going to give you some do's and don'ts. What should you be eating? Unlimited non-starchy vegetables, okay? Some fruit, plenty of meat, poultry, and fish, but really high quality stuff. Organic, grass-fed, grass-finished, meadow-raised, range-fed, happy chickens, fertilized eggs. All right, I won't get into the happy chickens, but range-fed eggs, okay? Natural fats, okay? Lots of good, high-quality natural fats. Some nuts and seeds, and drink lots of water. Don't get away from refined carbohydrates, cereal grains, sweeteners, bad vegetable oils, legumes, dairy products, soda, juice, and alcohol, okay? So those are the do's and don'ts. Do the do's and don't do the don'ts. All right, so acid reflux and heartburn, the last one. So this is the one we see quite a bit of, all right? So everybody comes in here and just, oh yeah, I got this going on. I thought I was having a heart attack. You know, we hear that quite a bit. Acid reflux, all right? So this is like, in the modern life, we're seeing more and more and more of this for 10 reasons, okay? For 10 reasons. But usually it's because of the fact that everybody's under chronic social stress. Say yes if you agree with me. Choking down their foods, okay? Choking down crappy foods, okay? And the fact that we're sitting all the time and creating problems with our thoracic spine. So this is what it looks like. So here's the inside of your gut, inside of your stomach. You can see this food bolus settled at the bottom of the stomach. What you'll see here is there's a sphincter at the top here, a muscular valve that keeps this a one-way street, typically, okay? So everything should be going in this direction, yes? All right, so this valve keeps us a one-way valve, all right? So there's a differential between these two in their acidity levels. So this environment here in this stomach likes to be about 4.3, okay? And this likes to be about 7.4 in the esophagus. Okay, so there's a big acidity difference here. That sphincter separates the two. It's a valve, okay? It's a trap door. Food comes in, opens up, drops through, and slams shut through, okay? The stomach churns the food, mixes it, and it's a really acidic environment to break down all your proteins, fats, etc. Yes? Okay? So when you have reflux, what happens is the food actually, as the stomach churns the food, refluxes this acidic bolus up back into the esophagus. So you now get this hyper pH, or this really acidic bolus getting up into this basic environment, irritating this sphincter and this esophagus. Do you guys get that? Okay. So what happens is it's a tonal issue. There's a tonal issue in this valve, this one-way valve that keeps all of that in the stomach. So what we find clinically is that in the upper thoracic spine, T4 to T6 clinically influence that valve and affect the tone of that valve. So imagine if that valve slams shut and it's nice and tight, the food's not going to come up and through. But imagine, just like if you had, you know, a problem with your 7th cervical and it would affect your arm muscles, okay? Imagine in here in T4, T through T6, it affects the tone of that sphincter so that trap door doesn't slam shut. So now you got food just pushing up and through, and it irritates. Does that make sense? So this is more of a physical problem. And this is where I'm finding is there's just more and more of this going on. This forward head posture, that creates this thoracic subluxation. Raise your hand and stomp your feet if this looks like you most of the days. Now it's 7 days a week, right? The average American like 60 hours a week in front of a computer, okay? Those poor spines. And this is what creates that upper thoracic subluxation. Make sense? Easy, right? All right, because most people want to talk about what causes subluxation. And they think, oh yeah, no, it has to be a total wipeout, and you know, so they visualize that and like, oh yeah, totally subluxated. But this is what we see more of, okay? So it's this now, this totally sedentary, unnatural, toxic, deficient lifestyle that's producing the subluxation patterns that we see. All right, so you know, it's the posture in the car and the commute, even when you're working out. Who falls asleep every night? I mean, say yes if you see yourself up here. Okay, is this your day or what? All right, so this is, you know, at the end of the day, how do you correct this problem? How do we correct the problem? What we teach is this three-legged stool. All right, the three-legged stool of correction is we do what are called specific chiropractic adjustments. So with our hands, we reposition the joint and we train it back into a healthy position over time. Gently, specifically, restoring the alignment and the function of that spinal joint so that the inflammation goes down, the pressure comes off the nerve, and the body's allowed to heal itself and run itself. Make sense? So the adjustment's done in rhythm so we can get ahead of the problem. Retraining the spine. Breaking the bad habits. Would you agree if you keep doing what you've been doing, you're going to keep getting what you've been getting, right? So you can't just keep, we don't want to be shoveling sand against the tide. We teach you guys, these are the things that you're doing that are creating these bad habits that are creating your subluxation pattern. So part of our jobs as coaching you guys is teaching you this and teaching you what exercises to add to your regimen so that you can hold your adjustments better because you can strengthen the soft tissues around the subluxation. Because a long-standing problem, you're going to get atrophy. So we add specific exercises so you hold your adjustments better. It's all about holding your adjustments so that those nerves can breathe and feed the tissue. Make sense? All right. So in closing, how do you know if you have subluxation? Well, we use 5 specific objective criteria to measure for nerve interference. We use instrumentation, which is a lot like a stud finder looking for inflammation. Okay, that's called the scope. We do motion palpation because I'm sure it makes sense to you that a normal healthy spine should move through its ranges of motion naturally, and a swollen joint spine, swollen joint in the spine won't move properly, and you can feel that articulation. Static palpation, it feels like a bruise on an apple when we run our fingers down your spine. When you hear me say, which one's more tender, 1 or 2? We're not playing games with you. We're just trying to find where the inflammation is, right? And then there's X-ray, of course, and visualization. So visualization is awesome. Visualization is a very powerful tool that we use to determine if somebody may be leaning away from nerve irritation, okay? So does it make sense to everybody that in a natural, healthy, normal, healthy body, your body's going to be balanced, right? It's going to be head over shoulders, shoulders over the pelvis, right? And if you look at a spine from the side, it's ear over shoulder, shoulder over the hip, right? And the body is it smart or stupid? Very smart, right? So the body, if it senses nerve irritation, it simply leans away from it. Functionally, what it's trying to do is open up the joint so the nerve can breathe and feed your body. But that creates 2 things that we can measure. A difference in how you carry your weight, your postural deviation away from normal, and then also a difference in how you carry your weight. So we have you stand on 2 balances so we can see if there's any differential in how you carry your weight, all right? So I need a volunteer. Front row! Give her a hand. Front row. You're not shy, are you? It's more fun if you are. No, okay. I need a shy person. I'm only kidding. All right, so we're going to check your posture.
Okay.
Okay? So what I'm going to have you do is I'm going to have you just stand right in front of the television and face in that direction. I'm sorry, what's your first name again?
Michelle.
Michelle. Okay,
Yep.
so Michelle is going to stand at ease. Can you step forward so everybody can really get a good look at you? Okay, there you are, yeah. She is so red, you guys. All right, this is awesome. All right, so I want you to close your eyes, eyes forward, stand at ease, okay? And I'm just going to fix your hoodie here.
Yep.
All right, so we're going to do 3 imaginary lines across your ears, across your shoulders, and across your hips. Okay? So I want you guys to tell me, as a group, you guys get to play doctor, which ear is higher, the right one or the left one? It's Sarah. What do you see? It's the left, right? That's it. Yeah, I saw that one before. Okay, how about across the shoulders? This one's easier. Which shoulder's higher, the right one or the left one?
The right.
It's the right one, right? Yes. Okay. And pelvis. Which hip is higher, right one or left one? You got to get this. Okay, right one, full on, right? Okay, so you can see this in the rotation in here too. All right. You've got issues. Okay, all right. So typically what I see here more with her is a bit of forward head posture and roundedness in the upper back. Okay, so traditionally that's something coming out of the thoracic spine. Okay, so like we said, this is T4, T5, T6, T7. That's a lot of the stomach, muscles of the upper back, but also the stomach, digestive tract. You see a lot of issues like reflux, heartburn, that kind of thing. So everybody give her a round of applause. So that's a quick, simple, easy test, you know, and we had some fun here tonight. We had some laughs, but I don't want to make light of something that's as serious as your health, right? So I want you to know that every single one of you should have your spine checked. Every single one of you, and we're going to make that so easy, and it's an absolute no-brainer. What we want to be able to do is if anybody would like to have that test and the rest of a consultation set up, we're going to offer our new patient examination experience, which includes a consultation with the doctor, a more in-depth chiropractic examination, which would include any and all necessary x-rays, and a complete report of findings with the doctor. That's usually a $285 exam, but we're offering that for $47 for our guests here tonight. So I'm going to encourage you to sign up. Dr. Justin and Dr. Derek are here to schedule appointments, or if anybody wants to get checked tonight, they can get checked tonight, just a quick postural evaluation. But take advantage of that, please. Say yes if you're with me. Yes? Excellent. All right, so I hope this was informative, and I thank you guys for being here tonight, and I'm going to stick around for Q&A. Very good? Very good. 39 9 minutes, sorry. I went over. All right, questions? Anybody have any questions?
How do you monitor progress?
How do we monitor? You recheck these same 5 objective criteria. So every 12th visit, we will do a progress examination, progress report, and then we do re-x-rays at a 4-month mark and a 12-month mark. So we measure all 5 objective criteria consistently with each visit. And symptomatically, I would want to see symptomatic responses as well as objective improvement and changes. Question?
So you do a baseline one as well, right, at the beginning?
Baseline at the
Because,
beginning.
Like, if I had a cracked collarbone and my right was higher than my left to begin with, or whatever.
So we establish what would be your 0. So we talked about that fractures, that's going to change your posture. Some people have a shorter leg or they had a hip surgery or whatever. You want to be able to look at that and you see that consistently come out, and that's your 0. Yeah. Other questions? Anyone? Anything? No? Piece of cake?
Well, actually, I have a
Go ahead, Paul.
comment. It's
Yes.
kind of interesting that for as many years as I had my illness, not one day or not one conversation was there anything about any of this information. Not even nutrition.
How many doctors did you see?
I can't even tell you. I mean, it's just like... and,
30? 50?
yeah, and so...
Did they talk to you about your nervous system?
Did talk about my nervous
Your tissues?
Didn't talk
Your
about my
diet?
tissue, didn't talk about any of the things that were going on. They talked about the causes, didn't even mention food. They just started throwing drugs at me. And that's it. We talk about this. It's sick care. It's not wellness care. So I'm just flabbergasted by that, number one. But also, I could have saved myself a world of hurt if I knew
Yeah.
even a tenth of this. And
That's why we're here.
yeah, that's thank God it is.
So I'll tell you the story, and this is by no means of my bashing anybody in any profession, the medical profession especially. The danger is not, the enemy is not there. The danger is in the paradigm. Okay, so you understand what a paradigm is, right? It's like your perspective, it's your belief system that it develops. When you start to defy people the ability to look at the truth of how magnificent and awesome their body is, number one. And you start to tell them that they are at effect and it's their genes and that's what's determining everything about their health, and no matter what they do or say, it doesn't matter, right? Or that you start telling people that there's nothing that can be done. That whole belief system that gets shaped, and that your body's just prone to break down. What you need is a drug, to get by. I just had a patient yesterday who is a smoker. She started working out. She's tried to quit smoking a couple of times. She's really given it hell. I'm proud of her. She's getting adjusted now. She's really changing her diet now, really trying, right? But she's had her 5th colonoscopy 5 years in a row because they keep finding polyps in her, right? So on this visit, now that she's been a patient here, she asked the doctor, so is there anything that I can do outside here between these colonoscopies, because my diet and my exercise, or is there anything I can do? And the doctor turned and said to him, no, you're just a person that makes polyps. There's nothing that you can do. And I felt defeated just for her, and I was just like, how do you not take advantage of the moment that a patient turns to you and says, what can I do between my annual polyp removal? And you say, no, there's nothing you can do. There's a person reaching out to you saying, that's what kills me. Okay? If they could just step up and be like, hey, yeah, you know what, you should eat, move, and think like your life depends on it. And then we'll check you every year and we'll remove something that's gone sideways. But otherwise, the other 364 days and 23 and a half hours are up to you. Right? Why can't we do that? Why can't we start with the moms and say, look, you are going to have massive influence over your children's future, their health, their life, and everything about them. You've got to teach them right now how to start eating properly and start moving and speak into their spirits and build them up. You guys know what I mean, right? Why can't we do that proactively as opposed to just waiting until the house is on fire and just start taking out body parts and throwing chemicals at it? That's just not healthcare. I think you guys deserve better, and I think that we all deserve a better way. Okay? Great. Thanks, gang. Have a good night. Drive carefully.